Julia Gray woke to a pounding headache and a sense of fatigue. Her job in marketing was hectic, and she often skipped breakfast, grabbing a sugary latte on the run. She had a sweet tooth and a weakness for salty snacks, and she had once smoked socially in college, though she had cut way back. With a family history of heart disease, her father had a heart attack at 60, Julia could not shake the worry. At her annual checkup that morning, the nurse recorded her blood pressure. It was higher than normal. Dr. Patel looked over her chart with concern. "Julia, your blood pressure is in a worrisome range," he said gently. He reminded her that high blood pressure often has no symptoms, so catching it early was important. He also noted that her cholesterol was a bit elevated and mentioned that doctors recommend checking cholesterol every 4 years. Julia realized this was a wake-up call. She had been lucky not to feel any pain yet, but her risks were stacking up. Julia started small. In the kitchen that evening she swapped her usual cheesy pasta dinner for whole grain pasta tossed with spinach, tomatoes, and grilled chicken. She remembered reading that heart-healthy eating emphasizes fruits, vegetables, whole grains, and lean proteins, so she reached for herbs and lemon instead of the salt shaker. By the end of the week, snacking habits had changed too. Apple slices with peanut butter or a handful of almonds replaced chips and cookies, and Julia even started a tiny herb garden on her windowsill for fresh basil and parsley. At the same time, Julia made exercise part of her routine. She started by walking for 30 minutes every morning before work, enjoying the sunrise and a favorite podcast. Some days she turned chores into workouts, parking farther from the office, taking the stairs, doing push-ups during TV commercials. Each evening, she looked forward to brisk walks in the park with a neighbor, which boosted her mood. She recalled her doctor's advice and national guidelines, roughly 150 minutes of moderate exercise each week, about 30 minutes a day. To keep a heart healthy, Julia also took to heart the advice about tobacco. She had smoked occasionally at parties in college, but now she quit completely. She told herself that any smoking greatly increases your risk for heart disease. Each step felt like a small victory over her old sedentary habits. And she had no intention of touching a cigarette again. Whenever cravings struck, she sipped cold water or peeled an orange instead of lighting up. She felt proud when a week passed with no cigarettes at all, and she knew that quitting would immediately start lowering her risk. Managing stress became its own project. After work, Julia made it a point to turn off her phone and spend a few minutes doing meditation or deep stretching, which helped quiet her racing mind. On weekends, she and her friends met for group hikes or afternoon strolls. These social outings were good for her heart, too. Studies show feeling connected with others can have positive health effects. In the evenings, instead of doomscrolling on social media, Julia read novels or played her guitar, finding calm in creative activities. These simple pleasures helped her unwind, so she slept better and felt more patient and energetic each morning. She also kept up with doctor visits. At her 6-month follow-up, Dr. Patel checked her blood pressure and cholesterol again. Julia remembered that guidelines suggest measuring blood pressure at least every 2 years cdc.gov and checking cholesterol every few years cdc.gov. So she was glad to stay on schedule. To her delight, her blood pressure was down and her cholesterol was within a healthy range. "All these habits you're building are exactly what the heart needs," the doctor praised. Julia left the clinic glowing with relief and hope. Months into her new routine, Julia found she felt lighter and more alive. She still enjoyed her morning walks and healthy meals, and now she used a fitness tracker to count her steps as a fun reminder. Some days she jogged part of the way to work instead of taking the bus. Mornings felt fresh as she watched the sun rise and filled herself with gratitude. Sitting on her porch with herbal tea in hand, she reflected on how these small changes had made a big difference. The journey wasn't over, but each new day proved that her steady new heartbeat was here to stay.